Excellencies, we are now live for this webinar session. Your Excellencies, dear colleagues and guests, it gives me great pride and pleasure to welcome you to today's webinar entitled Global Outlooks in the Fight Against COVID-19, Insights from the UK, Bahrain and Israel. My name is Dr. Mohammed Al-Shaban. I'm the Chief of Health Policies and Programs at the Supreme Council of Health, and I am member of the National Medical Task Force to combat COVID-19 here in Bahrain. And it gives me great pride to be chairing and moderating today's panel. Today we are joined by an esteemed number of panelists, and we're very proud and grateful to be having them with us today. From the UK, our speaker will be His Excellency MP Nadhim Zahawi, Parliamentary Under Secretary of the State at the Department for Business, Energy and Industrial Strategy, and Parliamentary Under Secretary of State at the Department of Health and Social Care. We're also joined today by Dr. Khetam Hussein, Health and of Infection Control Unit and Corona Department at the Haifa-based Rambam Healthcare Campus in Israel. And of course, joining us from Bahrain is Dr. Jalila Said Jawad, the Chief Executive Officer of Primary Healthcare Services and members of the National Task Force to combat COVID-19. A very warm welcome to all our panelists in today's session. Just a few comments. Please note that this webinar will be recorded, and to members of the audience, please feel free to submit your questions via the Q&A function. Please make sure to type your questions so we can see them. Obviously, the chat box will also be open for any comments or remarks. So in today's conversation, like we said, we will be talking about the experiences and insights of the different countries in combating this global pandemic, the COVID-19 pandemic. I would like to begin with giving the floor to the panelists for opening remarks regarding the overall COVID response in their respective countries. Your Excellency, MP Nadhim, maybe we can start with the UK.
Thank you very much, Dr. Mohammed, and thank you to my great friend, Sheikh Fawaz, for hosting this, and I'm looking forward to hear from both our Israeli colleagues and, of course, our Bahraini colleagues. And I'm really delighted to be here to share the United Kingdom's vaccine deployment strategy and our roadmap out of lockdown. Over the past year, we have evolved our approach to combating the COVID pandemic and made, I think, some pretty remarkable achievements considering where we began back in March of 2020 with this virus and this pandemic, whether it be with only being able to conduct about 2,000 tests a day to now regularly averaging above 1 million tests a day, or of course with the vaccines. We secured access to more than 450 million vaccine doses. We were the first country to approve the Pfizer-BioNTech vaccine and have now vaccinated well over 30 million of our people. We established the largest COVID testing infrastructure in Europe, and you will see more of that as we continue down that road of unlocking our economy. We have sort of in parallel strengthened our border measures to mitigate the risk of importing new cases and new variants. And of course, in response to the unparalleled economic shock created by the pandemic, we provided one of the most comprehensive and generous packages of economic support globally. At all times, we have been committed to transparency. We routinely publish COVID-19 data and statistics, as well as scientific advice, and communicate regularly with our people. Of course, in uncertain times, the vaccine provided that real certainty. For the first time, we were able to see our way out of the pandemic. We were the first country, of course, to authorize a COVID-19 vaccine. This was a real landmark moment in the pandemic, not just for the UK, but across the world. Now we have 3 licensed vaccines, and with every jab, another person starts building that health protection within their home, their community, and of course, the country. By the 15th of February, the National Health Service, with it, our armed forces and our local government, had met their target a day early to offer the vaccine to everyone in the top 4 priority cohorts: the care home residents, frontline workers, those over 70, and those who are clinically extremely vulnerable people. This was a really major milestone made possible by the tireless dedication of all those people involved, including 80,000 volunteer vaccinators and 200,000 volunteers, because 88% of mortality came from those 4 top most vulnerable cohorts. On the 20th of February, the Prime Minister, Boris Johnson, accelerated the program to complete phase 1, offering all adults over 50 a first dose by mid-April. Phase 2 will then commence with the remaining adult population offered their first dose by the end of July. And I'm pleased to tell you we are on track to meet our targets. It is a source of great pride to say that half of all adults in the UK, the half most at risk to COVID, have received their first dose. This means almost 95% of people aged 60 and over have been vaccinated. We are also continuing to do everything we can to encourage people of all backgrounds and ages to get their jabs. Thanks to the success of the vaccine rollout, we can look ahead with real confidence and hope, and we will do this with our roadmap to recovery. It is informed by the latest scientific thinking, of course, and the evidence, and seeks a real balance between social and economic priorities, whilst obviously preserving the health and safety of the country. At each step, we will make an assessment against 4 tests relating to vaccine deployment, the impact of vaccines on hospitalization and death, the impact of infection rates on the NHS, and the risk posed by new variants of concern. Those are the 4 tests that we apply at each step. We know from the scientific evidence that opening too early or too quickly risks a further lockdown. Our roadmap provides a really cautious but sustainable path in our view. As such, movement through each of the roadmap's 4 steps will be driven by data and not dates, be driven by evidence as we move forward. We also recognize how critical international collaboration is to tackle the pandemic. The United Kingdom is a founding member and among the largest donors to the COVAX Advanced Market Commitment, having committed £548 million to help give lower and middle income countries equitable access to vaccines. Additionally, the UK has world-leading genomic sequencing capability. We're creating a new variant assessment platform to offer UK genomic expertise and capacity to support countries that suspect that they have a new variant, but do not have the sequencing capability or capacity needed. It is really vital that the international community is better prepared for future threats. And right now, the vaccines are working and having a real impact, protecting the NHS, protecting people, and putting us on the right track out of this pandemic. Beating a pandemic is a global effort, my friends. We all have to play our part. Our role is a critical role, and our responsibilities, not just to ourselves, to the world, to each other in our countries, and of course, building that protection and resilience for the whole planet from future pandemics. Thank you for having me. Very happy to take questions.
Thank you, Your Excellency, MP Nadhim, for shedding light on the British experience in combating COVID-19. We might explore your experience further throughout today's panel. Dr. Khetam, if I move to the Israeli side and ask you and pick your brain on how your overall view is of the Israeli experience in combating COVID-19.
Thank you very much. First of all, I want to thank you for giving me this opportunity to be with you and share our experience in this very honorable event. I just want to show you some of our data and experience. My name is Khetam Hussein. I'm an infection control and infectious disease specialist that works with the Rambam Healthcare Campus in the north of Israel. It's actually the only tertiary hospital and the biggest one at the north of Israel, and serves over 2 million citizens. And as a result, we were very busy during the last year treating COVID-19 patients. As you all know, in Israel, we have the first wave that started somewhere there in the end of February 2020, with the first patient coming to Israel from abroad. And the first wave actually was very easy in Israel. We have almost 17,000 patients only. But this easy wave gave us the opportunity to prepare our healthcare system and be prepared for the second wave that arrived in the summer, when everything was opened and people were celebrating outside. And very quickly we had to have our second lockdown at the end of September 2020. The cases, the number of cases was decreased very quickly, and we reopened everything almost. But to our we started to see a rise in the cases in the beginning of December 2020, and that was the third wave. That was very, very difficult, more severe. The patients were were younger and more severe than and critical than in the previous two waves. But during this wave, we have two different measures that made this wave different from the previous two waves. And the first of all was the mutations. As I said earlier, that the mutations caused the patients to be more severe, more critical patients, pregnant women, younger patients. But also we started at the 19th of December 2020, our vaccination campaign. Actually, after our Prime Minister was vaccinated on the night of 19th of December, we started to vaccinate all healthcare workers, first of all at the hospitals, and then in the community healthcare system. And also we vaccinated citizens over the age of 60 years old. And this campaign, during this campaign, we have to deal with a lot of fake news. It was very hard for us to convince people, especially in special communities, like in the Arab community, in the religious Jews community, about the vaccine. There was, as I said, a very very strong campaign against the vaccine. But it's known since the first vaccine, the smallpox vaccine in the 19th century, that there are always the fake news about the vaccines, and I think by the time, as the time was coming, and the people were seeing that a lot of the healthcare workers were vaccinating, people over the age of 60 were vaccinated, we were able to convince our citizens to join and be vaccinated. And as of 2 days ago, we are now with over 5 million citizens that had at least one dose of vaccination, and 4,800,000 that are fully vaccinated. It's about 53% of all our citizens that are already vaccinated. There's about 23% that are under the age of 16, and that they are not allowed now to be vaccinated. So we are reaching the numbers that we had assigned for us to reach in order to get the herd immunity. And also in the special communities that I mentioned earlier, the Arab community and the Haredim, the religious Jews community, we are seeing that the rates of vaccination are rising also. We reached almost 84% of all Arab citizens over the age of 50 years that are vaccinated now, and about 74% of the Haredim over age of 50 that are vaccinated. We have to mention here that in these communities, that the rate of children under the age of 16 are higher than in the common, in the general population. And this wide successful campaign, vaccination campaign, caused us to see the decrease in cases. The decrease was not very quick, as we see in the second wave, because of the mutations that I mentioned earlier. But we can see a sustained decrease in the number of cases, and as Excellency mentioned, we are doing this, getting out of the lockdown, of the third down, very slowly, and every time there's another part of the restrictions that are we allow people to go down. The schools are open now. We still have capsules in the schools. The children are not learning all the days at the schools, but most of the working places are open. And last week we had the Passover holiday, and people at last had the opportunity to celebrate together and to be together after a very hard year that we had lately. And this decrease in number of cases, we also see it on the healthcare workers. We have the decrease started earlier than the general population, but we can see it. And in the last days, 2 days, we have 0 healthcare workers that are confirmed COVID-19 patients. So I think that we are now seeing the end, maybe the end of this epidemic, or at least that it is being easier. We are getting out of all the restrictions that we had during the third lockdown. And personally, if you allowed me, it's been a very tough year, but we have learned a lot of lessons here. I think we have a lot of resources, but our most precious resource this year was the human resources, being a part of all these significant and magnificent system that work together during this year, and to be able to get through this year was very important. And if we learned something, I think it's the humility and the humanity that we have to keep in our mind. So thank you, and stay safe. Thanks.
Thank you, Dr. Khetam, for shedding light on the Israeli experience and explaining such important insight. Dr. Jalila, if we could talk about the Bahraini situation now, and how did the country exert the efforts to combat COVID-19 from the outset? The floor is yours, Dr.
Yeah, thank you very much. I would like to extend my thank first to Bahrain Embassy in UK for setting this webinar where we can share experience and lesson learned, and to thank Dr. Khetam and His Excellency Mr. Nadhim for being with us today, and thank the colleagues and all the attendees. Kingdom of Bahrain set an example on how they manage this pandemic, where there was early planning started from the beginning, even before identifying of first cases. We set the National Task Force to combat COVID-19, and we established the war room where multiple stakeholders available and coordinate all the governmental response and maintain information gathering. We launched multilingual national awareness campaign and a national hotline where it advised the healthcare provider and the public for the best practice and the updated guidelines according to the phases. We have a strong health system in Kingdom of Bahrain to start with, and strong infrastructure in primary care and public health, and even in secondary care. And this infrastructure enable us to have appropriate contact tracing early on. And from this contact tracing, it helped to break chain of transmission several times and apply appropriate preventive measure and precautionary measure according to the phase and the stage, while implementing the public health measure, maintaining people's usual life without complete lockdown. So it is always a balance. Not only this, we have effective testing strategy where we have more than 17,000 tests conducted per day. And in spite of relatively smaller population size, we have more than 3,651,000 tests conducted, which makes most of the population of Bahrain at least tested once, if not more. And in spite of this testing, it is not only random, but it is a balance between a required testing for contacts, for those who have symptoms, for returned traveler or pre-travel, and also community testing, which is done through mobile team in the community, which make the service accessible for those who cannot attend the testing center, which is allocated in different places, for also enhancing the capacity and accessibility. And these testing, management, and protective measures all provided free of charge to Bahraini and all Bahrain residents. Also, we have the drive-through testing as part of the innovation done to enhance and accelerate the process and make quality and a quick service available for testing, and enhance and encourage people to come for these services. We launched the Be Aware application, which is an app available for everyone, where they can book their appointment for testing, and not only book their appointment, but they can get a lot of information in relation to the symptoms, testing, guidelines, information about COVID, about the location for testing, about their results, certificate of their results. And we built on this also a vaccine roll-up, where they can choose more than one, the type of vaccine they wish to take, and the location that they can get the vaccine which is of their choice. Also, we use it for electronic consenting, and also to provide any symptoms for positive cases. So it is enhanced contact tracing, enhanced testing, diagnostics, managing, and overall things related to the person himself, and maintaining confidentiality through appropriate services in this app. We did not stop on contact tracing and testing, but also in terms of management, we have advanced planning, where a number of beds has been doubled, field ICU has been provided and constructed, redesigned, and reallocation of different resources has been done. We have the executive committee, which is headed by His Royal Highness, the Crown Prince, and all the stakeholders and ministers are involved. And this reflects the strong political commitment in relation to appropriate planning and implementation. Also, we have the National Task Force, which is mentioned earlier, which met regularly more than 3 to 4 times a week, almost daily communication. And this is headed by His Excellency, the head of the Supreme Health Council, and with all the medical team and non-medical team, but of concern for implementation in phase-wise manner. Because we have a large number of testing, of course, we will detect more cases. We are transparent in numbers reported, which build confidence between the public and the government, and build the trust in relation to the services and in relation to the information provided. We have the health alert website, where always all the information required is there. And we have a multi-channel media and information availability for those who cannot read and write. They can use the hotline to ask about information with 3 digits only, 444, which make it easier for them. We have stations in several places that they can get more information in health center or in the exhibition center or in other. We have the Be Aware, and all the setups available for anyone to get the information in relation to COVID-19. In spite of diagnosing of more than 148 cases, 1,000 cases, we had a low number of deaths, which is around 0.4%, which reflect the supportive services provided for those cases, which is diagnosed, and early intervention for these cases. We set up a system even for those who are asymptomatic in home isolation. We continue to call them and track their symptoms. So either they themselves registered the symptoms in Be Aware, and they will have appointment to see appropriate physician, or we have actively calling them and ensuring that they report to health facilities and managed appropriately. We activated work from home, and by doing this, we ensure that the social distancing applied and the people are paid for their work from home, and they are available for the beloved people and ensuring safety of everyone. We banned public gathering early on in March 2020 and mandate masks in public. We have several innovation, effective strategic planning. We are all capitalization in our own resources and manpower. We train the manpower from healthcare worker, private and government partnership, different governmental hospital. We utilize also the training program for postgraduate to contribute to our manpower and resources, medical and nursing students. And also we opened the National Volunteering Platform, where a lot of people from community contributed to the health system support. We have the partnership with different governmental health sectors and non-governmental in terms of disinfection and in terms of supporting the community, supporting the governmental effort to combat COVID-19. And in terms of vaccine rollout, we have 5 vaccines granted emergency authorization. We started early and contributed to humanity, recognizing the importance of availability of safe and effective vaccines and supporting the global efforts. We contributed to phase 3 clinical trial of the inactivated Sinopharm vaccine in August 2020, and we recruited about 6,000 within less than 6 weeks. And among these 6,000, amazingly, we have His Royal Highness the Crown Prince contributing to the clinical trial, which lead by example and send a strong message to the public. We are here with you and for you, and we are part of this and contributing to humanity. And because of success of recruitment and the clinical trial set up in Kingdom of Bahrain, the number increased to 7,700. We granted emergency authorization to Sinopharm. Then we were the second country to give emergency authorization for Pfizer-BioNTech and roll it out. And by December, we have the national campaign for Sinopharm and granted approval. We have Covishield and AstraZeneca also have emergency authorization, Sputnik, and lastly, we have Johnson vaccine granted also emergency authorization. So we have 5 have emergency authorization, 4 available for choice of anyone eligible for vaccination. Vaccine, as I mentioned, provided free like testing in Kingdom of Bahrain. His Majesty the King ordered that the vaccine should be available for all and accessible for all. And this made us do a lot of innovation and to ensure accessibility. The vaccine available through 27 health centers located in geographically accessible distance. And also it is available through exhibition center. This exhibition center it acted like a multi-purpose. It was initially for testing, different type of testing, then for the clinical trial and for vaccine rollout. And by doing this, redesigning an exhibition center is part of the innovation. And also, we did not stop there, but we also set up Citra Mall, one of the malls, which is underutilized, to make it a part of the vaccination centers to enhance accessibility and build the capacity. We have advanced planning in terms of training, cold chain capacity, which is very important when we talk about vaccine, because we know that different type of vaccine require different supply chain. And Bahrain acted very early on. We have the ultra freezers, and we allocated all the consumables, auto-disabled syringes, to make sure that these are available for different platforms. We did correction of misinformation and recognizing that misinformation and vaccine hesitancy among the top 10 global threats. We acted early and transparently to the public. We talked to them about vaccines on a clinical trial, pros and cons. The information is available through the Be Aware on hand, through the health alert, through multilingual channel, through written and heard information, through the media, and through the national hotline. As I mentioned earlier, manpower allocated, financial support is there, economic support to the people working outside, like the private sector has been done. There was waiving for electricity and water, and all of these economic packages, which is provided by government, enhance the social distancing and enhance implementation of precautionary measures. We have also the registration, early registration, appropriate information system, which is a nationwide linked to the electronic database where we can identify comorbidities and morbidities, and also linked to the vaccination inventory and safety signals if identified, all in one platform, interconnected and country tailored and focused, maintaining confidentiality and autonomy of choice, because we have multiple platforms available. We did not stop there, but we will continue during our discussion about Kingdom of Bahrain. Of course, we set priority, those about 50 frontliners and people with comorbidities. However, we have walk-in services. where anyone above 60 or with comorbidity or special needs can go to any health center and receive the vaccines even without prior registration or appointment. We vaccinated more than 500,000 with at least one dose. More than 57% of registered above 50 have received their vaccines, and we did not ignore those who are vulnerable or cannot access the service. We go through mobile testing and mobile triage, mobile vaccination for elderly at home or those who cannot go by themselves, and also inmates. We went to the correctional places and we make sure that according to their choice, they receive the vaccine in timely manner. And these are examples of media campaign and what figures has been part of this vaccination, either political, strong political commitment, the governmental official healthcare provider, which is the messenger of health, and others contribute to the services provided. I think Kingdom of Bahrain, and I am sure, set an excellent example in leading the COVID-19 response, as well as our colleagues' country, and having this experiences and exchanging of information through such webinar, give lessons to the other country and role models in order to be either replicated or even enhanced in our countries. Thank you.
Thank you, Dr. Jalila, for the ample response regarding Bahrain's experience in combating COVID-19. Before moving to the Q&A, we are joined as well by His Excellency Hamid Al-Mahmoud from the Prime Minister's office. I just want to give him the opportunity to add on to what Dr. Jalila said regarding the Bahraini experience. Hamid, the floor is yours.
Good afternoon, everyone. Thank you for having me. Thank you for making the time today and putting this excellent webinar together with at least how we see it, the three top countries when it comes to the response to COVID, but also especially the vaccine rollout. We continue to look at both what the UK is doing on a daily basis and Israel with regards to the vaccine rollout. There is a lot to learn, and a lot have been adjusted here in Bahrain following the two excellent case studies of your countries. There is not really much to say from my side. Dr. Jalila gave a very good overview of our efforts. I think if I am to summarize, if you allow me to summarize, we're really proud of what we have achieved so far in terms of our COVID response, but also the vaccine rollout. And if I am to think or pinpoint why that has been the case, why have we been successful, I would say, number one, leadership. This effort was not left at the ministry's level to be dealt with, although it was at least at the beginning seen as a health problem. Most countries that we know of back then ran the response at the ministry's level. This was run by the Crown Prince himself and the Prime Minister. There was a task force set up led by His Excellency the Supreme Council of Health Chief, and with the Minister of Health and other representatives from the health sector, and the Minister of Interior, and even the Ministry of Foreign Affairs and whatnot, and ourselves at the Prime Minister's office as part of that task force. But again, leadership. His Royal Highness the Crown Prince in January of 2020 tasked me with setting up what he then called a war room. It did not back then, in all honesty, feel like we would need a war room. He was right. He saw it coming. Even though most of us didn't, I will not take credit and say we saw it the way he did. But in January, when there were no cases, not only in Bahrain but around the world, we thought it would be something that would potentially not come to us. He said, set up a war room, set up a task force, set up field hospitals. I want the capacity ramped up, and we did. And thank God that we had his vision, and we had a great team to implement. The second point was the early response. We were not reactive. We had the instructions to be ready for the first case almost a month in advance of the first case coming into Bahrain via the airport. We had testing set up in the airport. We had multiple PCR labs set up. I remember calling one of the companies that sets up the PCR machines in January, and I said we want to buy 3 machines, and the response was, isn't your population roughly 1 million? You really do not need 3 machines. Buy one and you'll be set. But we did buy those 3 machines. Now we have 10, and we're in the process of buying more, to the extent that we've been able to test over 3 million tests in a country with a population of 1.5 million. More than 70% of our population has been tested at least once. So early response. The third point is it was a cohesive response. The multi-stakeholder approach. All the entities played a role. Again, I have no background. Well, maybe I do now, but I had no background in health whatsoever. But I was brought in to lead and run the war room with no experience from the medical side. But I had, I was brought in to run the operations of it, and I had a team, including Dr. Jalila, and a stronghold of medical experts with us. And last, I would say, is as part of our approach and why we were successful in combating COVID, at least so far, was to run a system parallel to the existing health system to combat COVID. We did not get COVID patients into hospitals that accept other patients. We built field hospitals exclusively for COVID patients, and that helped us maintain the steady flow of attention given to non-COVID patients without interruption. So that everything else was very well covered by my colleague Dr. Jalila, and I look forward to the Q&A session. Thank you.
Thank you, Hamid, and thank you to all our panelists for shedding light on the experiences of their respective countries. For the sake of time, we'll start with the Q&A session now, and we have a number of questions pending. I'll start with Dr. Michael from the University of Oxford, and he says, with growing calls for an international pandemic treaty, what positive and negative lessons from international cooperation in your regions in general pandemic management and/or vaccine rollout do you think would usefully inform any future global agreement? MP Nadhim, maybe we can start with you.
Thank you very much, Dr. Muhammad, and thank you for the question. I guess if I reflect on our challenges, the greatest challenge that will face us in the future is obviously the variants of concern of this virus, which could cause any of us challenges. Of course, we are in much better shape, as we've just heard from Hamid. Bahrain is, and of course Israel and the UK, both in terms of diagnostics and in terms of future-proofing our vaccination program. So we're already thinking about our winter challenge, maybe with a booster shot for those who are most vulnerable, and we have a sort of 3-pronged strategy for that. One is working with the current manufacturers. One is introducing more messenger RNA technology to the UK and manufacturing in the UK with CureVac, which we've just announced. And of course, other vaccines that we have coming, Novavax and Valneva, just announced some very good data that will form part of our future proofing of the annual COVID vaccination when it moves from being a pandemic to endemic, we hope. But our big offer to the world is around genome sequencing, which I mentioned earlier on in my speech. And I think actually, if there is one area that we all need to urgently collaborate on, and the Prime Minister is using his G7 presidency to really push this hard, is not just the current vaccination program, but actually holding a library of all the variants that could occur. Because if we're going to see some virus escape, we want to be ready for it so that collectively the world can have the variant vaccine ready Boris Johnson has set us a target of 100 days to have it ready in the UK. And I think that would probably, for me, be the most important thing, so that we never face the similar, quite dire situation of these severe lockdowns that we had to face late last year, obviously even earlier last year with the first landing of the virus in the United Kingdom. That would be my sort of big focus, would be to say, how quickly can we create this library? And we've made a big offer to the world, especially those countries, low income, middle income countries who can't afford to have their own genome sequencing infrastructure.
Thank you, Your Excellency. Dr. Khetam, maybe we can look at this from the Israeli side. With regards to whether there is any potential for collaboration, and this webinar is a platform for these lessons to be learned from each other. What do you think the importance of this international collaboration or regional collaboration is in fighting pandemics, whether this one or God forbid, pandemics in the future?
Yeah. Yes, I think the collaborations between our countries and other countries also in the field of research, of diagnosis, of treating patients is very important. Also in the field of manufacturing vaccines, to have our local industry having the vaccines and not be and be able to provide the vaccines at very early in the future. So as was said, that maybe we are getting from a epidemic to endemic situation, that we will need to revaccinate our citizens, and it's very important. Actually, I think that there is some collaborations that works already between our countries, and also with in the field of research, and also about there's talks about collaborations, and I hope that these collaborations will be we will be able to do this sharing with the experience and what we learned from this epidemic.
Dr. Jalila, I'll leave the floor to you now with regards to what do you think are potential areas for collaboration between the three countries? I mean, Bahrain is already part of several regional and international cohorts where this is being discussed on a regular basis. But how do you foresee this collaboration going forward, especially from this webinar? You're on mute, Dictora.
As I mentioned, for Kingdom of Bahrain, people's safety is always a priority, and we are always ready to contribute to humanity and global collaboration and coordination. And we are part of several international collaborative efforts, including with our colleagues, countries, UK, Israel, and others. We are open to collaborate with all the countries to provide the best for our nation and for the globe, in terms of research and development, in terms of training, in terms of coordination for appropriate international efforts to overcome this pandemic and any emerging disease and any health-related issue that might impact any individual, either in our kingdom or in the globe. We have a lot of expertise, and also there are expertise that could be exchanged whenever the need is there. And also, as mentioned earlier by the colleagues, training, education, and management is always part of it. This webinar set an example of collaborative effort where people can exchange experience and learn from each other to enhance practice to the benefit of their people and the globally. And we already signed Memorandum of Understanding, as per my knowledge. When I say we, I mean Kingdom of Bahrain and the health sector with UK. And there are a lot of potential area for collaboration with other countries, including UK, Israel, and others.
Thank you, Dr. Jalila. Dear panelists, for the sake of time, I'll try to combine some of the questions that are similar together. So we have a question to His Excellency MP Nadhim regarding the success, following the success of vaccination in the UK, what stage will the country reach herd immunity? And the same question has been asked for Bahrain. So Dr. Jalila and MP Nadhim, maybe we could start with Britain first, and then we move to Bahrain.
Thank you very much. So obviously I'm not an epidemiologist. My role is I'm a chemical engineer by background, was to operationalize the deployment at scale and make sure that the vaccines task force continues the supply side. We had originally, the NHS had modeled our uptake program to be about 75% of adults. We're running way ahead of that. This vaccination program has broken all records for vaccination programs in the UK, such as the flu vaccine. So amongst the cohorts that we're vaccinating at the moment, the 1 to 9 categories that the Joint Committee on Vaccination and Immunisation set for us, we are, including in the over 50s now, we are at, I think, 85, 86%, the over 60s, over 90%, over 70s, over 90%, over 80s, over 90%. So all in all our categories, we are smashing records here in the UK, and vaccine positivity is incredibly high in the United Kingdom. I think something like 90%, it varies depending on whether it's the ONS or other surveys, between sort of 86 and 94% of adults say they will very likely or most likely take the vaccine. My biggest sort of concern and focus is on some of the ethnic minority communities where we have slightly greater vaccine hesitancy. So that small percentage, anywhere between sort of 10 and 15% who are hesitant, skew much more to those communities. And we can't leave any community behind, which is why we launched an uptake strategy on the 13th of February, which we are implementing now, very much hyper-local, working with local government, postcode by postcode. We're trialing things like multi-generational households, where we vaccinate the whole household in parts of the country. Those trials are looking good. But in terms of my target, is to get to vaccinate the whole adult population, or as high a level as possible, by the end of July, because ultimately, if you do the calculation of a vaccine that, say, has an efficacy of 85%, and if you reach 85% of the adult population, you've only really protected about 72%, which still leaves quite a number of the population unprotected, and therefore space for the virus to infect and therefore possibly mutate. So combined with the vaccination program, we have a big surge testing program. We can now test 1.6 million tests a day in the UK. And this week we have announced the ability for the whole country, everyone, to receive 2 tests a week going forward. So surge testing, isolating, genome sequencing, and vaccinating.
Thank you, Your Excellency. Dr. Jalila, when are we expected to arrive at herd immunity in Bahrain? And if that is to happen, do we still need to wear masks and follow precautionary guidelines regarding social distancing?
Yeah, I will not repeat the things which has mentioned by His Excellency Mr. Nadhim regarding the herd immunity and reproductive number reaching the 70%. We have, this virus is relatively new. Every day it is mutating and more variants are coming. It is always, there is more to learn and more to add, more to change in every phase. So our aim to vaccinate all the eligible adults and to expand it to children whenever there is an evidence based on a clinical trial of efficacy. So as has been requested by His Majesty the King, the vaccine should be available and accessible for all, and this is our main target. So it is not only herd immunity, It is more than herd immunity is our target. Continuing with the precautionary measures should be there, because with the variant and variable efficacy, for those who cannot take the vaccine because of allergy or because of any contraindication, we need them to be protected until we are making sure that all the vaccines has been working in an effective way, and at least which is available, and certain protective level has been reached with a certain, with more knowledge arising with the variants which is available, more efficacy data in relation to the variants. So we will adhere with the precautionary measures in Bahrain, but it will be tailored according to the phase. So it is like we started, we are continuing, and hopefully we are ending together this pandemic with learned lesson and in a phase-wise manner.
Thank you, Dr. Jalila. We have a question from Tony Diver from the Daily Telegraph to His Excellency MP Nadhim. In light of the successful vaccine rollout in other countries on this call, Bahrain and Israel, would you agree with the CEO of Virgin Atlantic this morning that it makes sense for some Gulf states and Israel to be on the green travel list when it's published ahead of May the 17th? And can you personally recommend a holiday to these places?
Well, I think the answer to that very, very good question from an excellent journalist is you're going to have to wait and see. But clearly, there are a number of countries who have done tremendously well, not least Bahrain and Israel, of course, the United States of America and others. But the vaccines task force is looking at exactly how we are going to move forward with reopening the skies effectively, which is really important. Part of that obviously is also making sure we operationalize the ability for our citizens to have a test certificate or a vaccination certificate, which the NHS is working on at the moment, so that we make sure that the protocols that we all adhere to are global and can bring in other countries as they progress with vaccination, immunization of their nations as well.
Thank you, Your Excellency. We have a question for Dr. Khetam now, and from Roddy Drummond, the British ambassador. Can I ask our Israeli expert what the emerging Israeli thinking is about extending vaccination program to under 18s?
Thank you for the question. We already vaccinate young citizens from age 16 and older. And also we have a special license for children between 12 and 15 years old that have underlying conditions that and they are at risk for COVID-19 disease. So we have a few hundred of children that already have been vaccinated. About the vaccination for all children over the 12 years of old, we are waiting for the FDA approval of the Pfizer vaccination, and then we'll decide about opening it for all the children over 12 years of old.
Thank you, Dr. Khetam. We have a question regarding despite the tremendous success in rolling out the vaccine and its take-up by the vast majority of people from all communities to whom it has been offered, there is sadly still a relatively large segment of people who are deeply skeptical about the vaccine. Considering your important collective experience in this field, I would appreciate your thoughts how best to address this challenge. And thank you for this informative webinar. MP Nadhim, I leave this to you.
Thank you very much. A really important question. So one of the things we've done in the United Kingdom is to launch an uptake strategy back in February, 13th of February, that looked at exactly how we reach communities that we need to protect. So part of that is data sharing, really important that the NHS, our national health system, shares data at really granular level, at postcode level of uptake in different communities. What we learned from that is actually many communities want access to the vaccine at a time and a place that they really trust. So let me try and give you very briefly two examples. One is the Haredi Hasidic community in Hackney. We have a brilliant first responder ambulance service, the Hatsola first responders. They came to the NHS and to local governments and said, look, if you support us, we can vaccinate the community. So we did exactly that. And they managed on a Saturday evening at 8:30 p.m. to begin vaccinating. We did 364 vaccines that night, including some Muslim families who also came forward because they trust the Hatsola first responders. We did something similar in mosques, in East London Mosque, with the Bangladeshi community. And we've seen the Bangladeshi uptake in that community go from one of the bottom in terms of the different ethnicities in the UK to one of the top 4 in terms of uptake in particular age groups that we're focusing on. So, it is the making it hyper local. I described earlier some of the multi-generational households that we've been piloting with, sharing data with local government and transparency. We've translated all the information into 13 languages, from Arabic to Farsi to Hindi to Polish, across the board. That's how you overcome this. It's really important that nobody gets left behind, which is why our complete focus of our deployment infrastructure, which is massive. We got to doing 27 jabs a second a few weeks ago, is to now, between now and the middle of April, to complete the 1 to 9 cohorts, because they're the most vulnerable to serious illness, hospitalization, and death, sadly.
Thank you, Your Excellency. And it seems that we've run out of time. So I apologize to the audience. There's still a number of questions, but we will hopefully definitely be holding another webinar. But I can also see that we have been joined by Her Excellency Sharon Barley, the Deputy Chief of Mission of Israel to the UK. So I'll just give the floor to Her Excellency for closing remarks.
Thank you very much, Dr. Shaban, and I really want to thank Minister Zahawi, and thank you, Dr. Hussein and Dr. Jawad. Really, it's a great pleasure to have this event. And I have to say that on the backdrop of the abundance of Zoom events that are taking place and the Zoom fatigue that we are all suffering from, I think that this event was a unique event, at least from my point of view, because this is peace in practice. And therefore, really, I'm even more grateful that it was you, Minister Zahawi, who gave us who devoted to us your precious time, because not only that you are the master of an excellent vaccine campaign, but you are also someone who knows the Middle East and understands the Middle East. And therefore, I'm sure that you also appreciate the importance of this platform. I mean, for us, it's almost we're almost taking it for granted, but I will remind all of us that it's just about 10 months ago that Israel and Bahrain signed the peace agreement. And I really think that it's great that we're sharing this platform together with the UK, not in order to talk about conflict, but in order to talk about cooperation and how can we work together in order to improve situation and to make things better for the world. Our countries, Bahrain and Israel, are already cooperating in fighting Corona. There is an agreement ready to be signed between our ministries of health. I know that there are some collaborations taking place between Israeli and Bahraini hospitals. I know that there are discussions about putting together an industrial facility to manufacture vaccines. And of course, that there are discussions between our countries about joint recognition of the green passport that will eventually assist us also in opening the skies and getting to visit each other and to get to know each other better. So all this is really great news. And I want to thank all of you for taking part in this platform, and mainly to our audience. Thank you.
Thank you so much, Your Excellency. A big thanks as well to our panelists. Thank you, Minister Nadhim, Your Excellency, for your time. And thank you, Dr. Khetam and then Dr. Jalila, Hamad. Thank you so much for sharing insights and the experiences of the respective countries. And of course, we thank our audience and apologize for not being able to address all the questions, but hopefully we'll be doing this again soon. Thank you so much, everyone.
Thank you very much.
Thank you.